There are so many providers right now with a lack of training that are performing these aesthetic medicine procedures, so make sure they have a medical license. You can get a consultation and not treat. Also, what's the vibe? The vibe is so important, you guys, because when you are in a consultation, it's like you're on a date. Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi, everyone. Welcome to today's episode on The Perfect Dose podcast. Today, we are going to talk about some do's and don'ts when it comes to aesthetic injectables. And I'm going to come at this as an aesthetic medicine provider who's treated thousands of patients over the last 7 years. I'm a national trainer. I get questions all of the time in my practice on social media, and I'm going to break it down for you guys in today's episode. First do is find an expert provider. There are so many providers right now with a lack of training that are performing these aesthetic medicine procedures that should not be performing these procedures. These are highly advanced skills that really everybody can just take a beginner injectable course for and get certified in if they are a medical provider. That does not mean that they have enough education and training to be doing these procedures. So make sure you do your research and find an expert provider. Number one, they need to be licensed. So make sure they have a medical license as a nurse, nurse practitioner, physician's assistant, or a doctor. This is very important. There is a lot of counterfeit Botox, people doing Botox in their homes, people that are not able to be injecting are injecting these products. So make sure you find a licensed medical provider. That can be done simply by asking what your medical provider's name is, and you can research them on websites like nurses.com. You can type in their name and their license number will come up for you. So if you are seeing any injector, make sure that they are actually licensed. My next do when it comes to finding an aesthetic injector is to ask your friends. Referrals are one of the best ways to find someone really good that is practicing aesthetic medicine. I built my practice on word of mouth and social media. So if you have a friend and let's say they're looking really great, just be like, hey, who's your injector? Who does your Botox? Who does your skin? Who does your fillers? And hopefully if they're a good enough friend, they will be honest with you and tell you who. That is one of my number one recommendations on how to find a good injector is to ask for referrals. Word of mouth is so powerful, especially if you have a friend that looks really good or you see somebody that is looking amazing. Finding out what injector they go to is going to be my number one recommendation. My next do is to actually go to the clinic for a consultation. You don't have to treat that day, but you need to have a consultation. This is so important. A big red flag when you walk in the clinic is if everybody there looks unnatural and weird, including your injector, they look overfilled, you need to run. That is my number one red flag. An aesthetic provider is going to have a similar aesthetic to how they look. So what I mean by that, I tell my patients this all the time. I am a less is more, natural is in. I'm a very conservative injector, and you will see that when you come to my office. Nobody on my staff looks overdone or overfilled, including myself. We are like the low maintenance girlies. I wear minimal makeup. I don't even do my lashes. I am somebody that is very much less is more. So if you come into my practice and you're looking for big, juicy lips, I am not the provider for you. However, if you come to my practice, you're looking for a full facial balancing treatment plan, you're looking for natural results, you're interested in biostimulators, regenerative medicine, you will quickly find that we are a really good match. So what does the staff look like? Also, what's the vibe? The vibe is so important, you guys, because when you are in a consultation, it's like you're on a date. You are basically dating your aesthetic provider. You're finding out if they're a good fit for you. You're finding out if they have the same core values when it comes to beauty and aesthetics that you do, and you're finding out if you could trust this person with your face. So it's very much like dating. What is the vibe when you go in the office? Is it clean? Is everyone friendly? Are they greeting you? Do you feel welcomed? When you first meet your aesthetic provider, do they welcome you by stating their name, their credentials? Do they listen to your overall goals? Do they also provide you with education? And this is so important because when somebody comes into my office and they're here for lip filler, for example, they may not be a candidate for lip filler. And I am not going to be somebody that just gives them lip filler because they want to. I'm going to make sure that if they want lip filler, it has to be in harmony with all of the other features on their face. And what I mean by that is if you come into my office and you have a very recessed chin, for example, and you want bigger lips, I am not going to treat your lips until I treat your chin. That's because of facial balancing and facial harmony. If you were to just treat the lips, you would look like a duck. You would look over-projected, unnatural. You have to treat the chin and the lips in order to have a natural appearance. Something that's like really funny, I saw this on Instagram the other day and it has burned in my brain, you guys, is this meme. And it was like getting your lips done without a chin is like getting a boob job and having a flat butt. And if you literally just imagine this, you're going to be like, okay, that makes sense. So biggest thing, make sure you vibe with your injector. Make sure they provide you with education, that they're not afraid to tell you no. If they are afraid to tell you no and they seem like they're just listening to what you say, they're just going to do whatever you want, I think that's a really big red flag. When it comes to your face, you want somebody that has enough education and confidence, not to just hear what you need, but to also be able to tell you what you need and to be able to make sure that your goals align with a natural result. That's something that's super important. And also realistic expectations, right? I have patients that come to my practice for a consult and they're like, I want my face to look like this. I need to send them to a surgeon. I'm not going to be able to make their face look like that. So I am a very honest injector. I'm somebody that provides a lot of education. I make sure my patients understand the why. So why do you need filler? Ask your injector. Okay, so why are you recommending this? Let's say in your consultation, your injector is recommending that you get filler. You need to know why. So what's important to understand is that, okay, not just that you need filler, we're going to give you a little bit of filler here to lift your cheek. No, what's really happening underneath is that we are aging. We have fat loss, bone loss, collagen loss, and muscle laxity. So we are getting an aesthetic procedure to basically put back what was there before. And if your injector doesn't know that, I think that's a sign that you need to run. Another red flag at your consultation is if your injector is super pushy. And what I mean by that is not that they're telling you, okay, this is what you need, because I will tell my patients they need XYZ. I will break down full face. I'll say, look, this is your entire treatment plan. This is what I recommend. This is what I think is going to look the best on you based on your overall aesthetic goals and your anatomy. And then we make a plan. And I'm like, we either treat today to complete, we can break this up, we can do what feels good for you, and I leave it to my patient. And the only time I ever veer from that is, let's say my patient comes in and they're like, I want 20 units of Botox. Well, 20 units of Botox is not enough to treat their face. And I know that dose is duration. I also know that in order to have a really appropriate aesthetic outcome, you need enough units in your frown lines in your eyes to lift. So I will often tell my patients, hey, you actually need, let's say, 60 units of Botox. That's not me being pushy. That's me making sure they understand what's going to give them a really good result. So if they don't want to treat 60 units of Botox, I just won't treat them. Instead of getting them to be like, okay, you know what? Let's just do this 20 units now. We'll do this today. I just want you to do this. That's pushy to me. It doesn't feel good. You should really just feel like your injector has your best needs, your best interest at heart, and they are going to make a customized treatment plan that makes you feel really good, makes you feel confident, makes you feel very at ease in the clinic. Another red flag, if you are at your consultation and the price is too good to be true, it often is too good to be true. Aesthetic procedures are not cheap. We should not be price shopping for aesthetics. So when you go in for your consultation and they're telling you Botox is $8 per unit, you need to run, because I can tell you as a business owner, as a highly trained national trainer, expert injector, Botox actually cost me around $7 to $8 per unit. And that does not include all of my overhead, the cost of my needles. I have to pay my injectors. So it's something that has to be considered, not only just the price of the vial, but everything else that goes into it and the training. So a price at $8 per unit is way too good to be true. Do not price shop when it comes to your face. You are not just paying for the product. Again, you're paying for the product, the injector. There's also the overhead, how a business owner has to pay their injectors, medical supplies, you guys. We have to order so many medical supplies. Like, I'll give you an example. In a practice that is highly trained, highly expert, a clinic that you should go to, not only do they need to order filler and the needles and things like that go with it, we have to place orders for filler dissolver in case of an emergency. And this filler dissolver is about $100 per vial. We carry 20 vials at all times. We are hoping that $2,000 worth of product expires and we never have to use it. These are some of those back end things that go into the price of your filler. So when you are looking for a really good injector, do not price shop. And if the price is too good to be true, it probably is. I guarantee that it might not be a good product. That injector is not highly trained. We don't know if it's actually an FDA approved product even, because people are getting filler off the black market. It's like crazy. And does that injector have everything to be prepared in case of an emergency? Are they taking that into account, or are they just trying to sell you a syringe of filler? Think about it. Now that we've talked about how to find a good injector, the next do's that I want to get into when it comes to injectable treatments are about the treatments themselves. So I'm going to start with Botox. A big do with Botox is to actually wait 3 months before getting re-injected. And I know this is not what you guys want to hear. This is something that I often hear in my practice. I hear baby Botox. I hear Botox touch-ups. I hear my Botox has worn off. It's been 2 months. Can I come in early? And these are things that I'm going to recommend you actually avoid. Let's look at this graph. So the life of Botox. Botox is actually going to have a peak effect. And what that means is at the 2-week mark, your Botox is going to be in full force. I tell my patients oftentimes they can feel frozen, weird. They might not be obsessed with how their Botox feels at that point, but it will be pretty set in. By about week 3 to 4, the Botox starts to settle into the muscle. So you start to feel more normal. You don't look as frozen. Now, Botox, although it is indicated for 12 weeks, which is 3 months, it does not last. You will not be frozen for all 3 months. It has this peak effect at that 2 to 6 week mark because that's the sweet spot. So if you're having a wedding, big event, vacation, birthday, you want to look good, you want to make sure you get your Botox about 4 to 6 weeks before that big event. So it's at its peak effect and looks amazing. After 6 weeks, what starts to happen is it actually starts to wear off. So the Botox is working on the muscle and it basically blocks this neurotransmitter that makes your muscle contract. So as the Botox wears off, the neurotransmitter starts to contract again and you start to regain movement. So at 8 to 10 weeks, your forehead will start to move again, but it will not look like it did before you were treated. So just because you have some lines back, some movement back, that doesn't mean you need more Botox. It is recommended that you wait the full 12 weeks. And that's because just like an antibiotic, we have to have this medication take its full effect and then fully wear off before re-injecting you. Re-injecting too early can actually contribute to your Botox not working as well anymore. If you get Botox for years and years, you're getting baby Botox, which is Botox underdosing. You're treating too early. You're getting lots of touch-ups. You may find that you become resistant to Botox and it doesn't work as good or last as long. My recommendation is to not get injected more often than needed, which is 3 to 4 times per year. My next do when it comes to injectables is going to be to follow your post-care. You guys, this is so important. Anytime you go get filler and it says on your post-care, don't wear makeup after filler, that is there for purpose and reason. It is so you do not get an infection. We are creating little micro injuries into the skin every time we place a needle in your face. That injury is open for over 24 hours. It is important that you do not put makeup on after you get filler. Following your post-care is very, very important. It is a big do for me, so you can avoid any complications. Complications can occur with these procedures, so it's important that you follow your post-care to the T. My big don't, and this is something I tell my patients all of the time, is don't get over-injected. And this is very important. This kind of parlays with finding a very good injector, but getting over-injected is a possibility and can contribute to migration, can contribute to you looking unnatural. So it's important that you don't get over-injected with filler. And how to avoid getting over-injected with filler is by simply making sure you are addressing all 4 pillars of anti-aging: skin, muscle, bone, and fat. Filler cannot fix everything. We have to make sure that we are doing other combination treatments in order to have natural results. So for example, a common treatment plan that I'll put my patients on is filler for volumization. So when we lose volume, we add filler. Then we need skin tightening devices to tighten the skin. We need collagen stimulators in order to make our skin thicker, firmer, younger looking. We also need skincare at home. We need to protect our investment. So in order to avoid getting over-injected, make sure you are treating all pillars of anti-aging, not just filler. Hope you guys enjoyed today's episode. There were a little do's and don'ts talking about my most frequently asked questions in practice and my biggest tips on finding a really good injector so that you can get injected with the best Botox and filler of your life. I will see you guys next week.